How often do you floss? If you've ever been to the dentist, you've most likely been asked this haunting question by your dental hygienist, and maybe you fibbed and told them that you floss every day, but your gums bleed no matter what. Well, as one of those nagging dental hygienists, I'm here to tell you that we can see right through it. The bleeding, inflamed gums are the first sign that someone is not regularly flossing. Only floss the teeth you want to keep. This phrase is beautifully and elegantly painted on a wooden sign above my dad's office desk and was passed down to him from his father. I come from a strong line of dental professionals. Both of my grandpas were dentists. My dad, his two brothers, and 3 of my cousins are currently practicing dentistry, while my sister and I are both dental hygienists. I like to think of it as a part of my genetic makeup. And because of that, I feel a strong duty to educate those around me on the importance of oral hygiene and therefore their overall health. The Center for Disease Control conducted a National Health and Nutrition Examination survey studying more than 9,000 adults over the age of 30, and the results showed that over 32% of adults reported that they never floss, and over 37% reported less than daily flossing. The study also found that failure to floss was higher in men than in women, and that low-income participants are less likely to floss than higher-income participants. The results from this study prove that we need a stronger patient education to inform people about the benefits of flossing. While we are constantly telling people to floss, we might not be telling them why to floss and the importance of what it prevents. And I truly believe that the lack of education could be the reason that so many people do not floss daily. I believe it's an issue of just not knowing. As we improve the education and make sure people understand that something as easy as flossing can prevent dental issues, we can improve our overall health. I speak from experience. Even though I'm the daughter of a dentist, I have not always been a diligent flosser. It wasn't until I was in dental hygiene school that I realized how important flossing truly is. Simply being educated and seeing the positive results of flossing was enough to make me a believer. Now I floss every day and can't seem to fall asleep if I haven't flossed. It's addicting. Now I know this might sound silly, but hear me out. The American Academy of Periodontology confirmed that more than 1/3 of adults would rather do a task such as cleaning the toilet, doing the dishes, or sitting in traffic over flossing daily. 1 out of every 2 American adults has periodontal disease, according to recent findings, and that the Center of Disease Control. What is periodontal disease, you might ask? Simply put, it's bone loss around the tooth, but let me explain. When you do not regularly floss, a soft, sticky plaque forms on the tooth and actually hardens into tartar if not removed within 24 hours by either brushing and flossing. And once it hardens, it can't be removed with brushing or flossing. This tartar is what your dental hygienist is scraping off at your dental visits. I often explain it to patients as splinter-like or barnacle under the gums that prevents the tissue from being able to sit healthy against the tooth. When this barnacle of tissue or of tartar sits deep under the gums, it can cause an infection. The inflammation from the infection creates a large pocket for the bacteria to get down to the jawbone, eats away at the supporting bone, causing the teeth to become loose and eventually fall out, all because you didn't floss. Once the infection is in the bone, this is periodontal disease. And once that infection is present, it must be managed with regular dental visits. Interestingly enough, when it comes to personal relationships, the American Academy of Periodontology reports that 3 out of 5 adults who have a partner say that their partner's oral health has an effect on their intimacy. And over 1/3 of Americans say a smile is the first thing they notice when meeting someone they're attracted to. Now, these statistics really seem to contradict each other. As Americans, we place a lot of value on the appearance of our smiles, but do not seem to want to put in the effort to keep our gums and our teeth healthy. Studies have shown that poor flossing habits can negatively affect your overall health, and that periodontal disease affects the entire body. The Mayo Clinic has confirmed that bacteria associated with the plaque and bacteria in periodontal disease can enter your bloodstream and travel throughout your body, and it's actually the same plaque that is found in hardened arteries around your heart. Because of this, heart disease, stroke, dementia, diabetes, and respiratory disease all have been linked to periodontal disease. While periodontal disease is not always reversible, it is always preventable and controllable with proper oral care, including brushing and flossing and regular dental visits. After sifting through many studies and research, and personally seeing over 10,000 patients in my career, I have deduced 4 of the most popular excuses for why you don't floss, and I have a rebuttal for each one. I just can't seem to do it. Sometimes individuals with dexterity problems, such as those who have arthritis or who have suffered an injury, can have difficulty maneuvering the floss, but there are alternatives. Examples such as floss picks, interproximal brushes, and the water pick make it possible for our differently abled patients. I don't have time. While flossing may seem like a time-consuming task, if done properly, it should actually only take between 3 and 5 minutes. At first, it may take a bit longer as you are learning how to maneuver that floss and get used to a technique that works for you, but the more you do it, the easier it gets. Spending at least 3 minutes flossing can mean fewer dental problems, better checkups, and overall healthier lifestyle. I don't really know if it's necessary. Did you know that brushing only cleans approximately 60% of the tooth surface? That means we must floss to clean the remaining 40%. If you don't floss, all of the spaces between the teeth that your toothbrush can't reach aren't cleaned, and the bacteria is left to cause some serious damage. In fact, the most common place for cavities and bone disease, periodontal disease, to form is between the teeth. It hurts, and my gums bleed when I do it, so I don't. Healthy gums don't bleed or hurt when flossed. Red, swollen, or tender gums are warning signs that you could be at risk for gingivitis. I have friends and patients who tell me they don't floss because they bleed. If your gums bleed or are tender when flossing, you should start flossing more, not less. I often inform people that if you haven't brushed or flossed in a while, it's a lot like cleaning out a wound. It may be sore for a few days, but it will begin to heal. And if the problem persists after brushing and flossing regularly, you should consult your dentist. Clearly, flossing is incredibly important to a healthy lifestyle. As a dental professional, I can attest that once you begin flossing daily, you'll be on the road to a healthier, happier life.